Thank you. Thank you very much. Good afternoon, everyone. My name is Jenny Delos Santos, and I was born and raised in Ever Beach, but now I live in downtown Honolulu for the past 20 years. I have four sisters and one brother, and I'm married to Pancho and had two kids. In 1982, I married my ex husband, Miguel. He was an Army Ranger, and we were happy. We were really happy at the beginning, but later he started calling me all kinds of names, told me I was ugly, stupid, dumb, slut, whore, and all these degrading names. And it really worked in my mind. And it got even worse later after the kids were born. Charles, my son, was born in 1982, and my daughter was born in 1983. They were just 9 months apart. When Charles was 9 months old and Christina was 2 months old, she I there was a football game that the family wanted to go to, but I had to stay home because I had two kids, right? And I didn't want my husband to go, so we begged him not to go because I didn't know if I could take care of the kids on my own. And so he stayed home, but he was really really mad at me, and he just um, he just lay down on his side of the room, and his our bedroom, and I had my daughter Christina in my arms, and my son was in a playpen, and then he started crying, and I couldn't tend to him because I was trying to feed my daughter, and she was just two months old. I didn't know how to do it, and because my son didn't stop crying, the father got up and slapped him really really hard. It was really really long and painful. I didn't know what to do. I was scared. I was scared for the baby, that I had in my arms. That's what I was scared of. And I finally he stopped after a little while, and he went out of the bedroom. And when the family came home from the football game, they noticed our son. My son had all the bruises on his face. It was really super bad. And my mother said, don't call the 911 or the army, um, you know police, because he'll get in big trouble. His name was Frank. He'll get in big trouble. So I didn't. But I just had to comfort my son for a while, and I I was in terrible shape. And as the years went by, things got worse. But we moved to Washington D.C., where one time he wanted me to drive, and I wasn't good in driving. He taught me how to drive, but he always yelled at me and screamed at me. And one time he was trying to help me, well, not really help, but guided me on the freeway, and he was really really mad at me. He started yelling and screaming. The kids were crying in the back seat. It was really really bad, and I was all shook up, and thank God nothing happened, but he told me to go off the freeway and go to another section where he could stop the car. And he kept yelling at me some more. And it was really bad. And ever since then, I never did drive ever again since we left in Washington. Then we moved to California, and it was because he came out of his service. And the worst part of the abuse violence occurred when we lived in Vallejo in 1987. The neighbors in our apartment complex were very nice to me, and they talked to me a lot, especially the mailman Peter. During the summer of that year, my ex-husband kept me up for hours and hours at night. He would yell at me and scream at me, call me all kinds of names. He even had guns. He owned a lot of guns. Back then, anybody could own a gun. There was no restriction about it. And he would load up his guns, and he would point the gun's barrel to my face and tell me, I'll kill you, the kids, and the people around us if you don't admit that you're fooling around. And I wasn't. I wasn't fooling around. And he did that for 3 months straight. And I was very terrified. I didn't know what to do. We were alone in California. It was really, really hard. And finally, a neighbor came up to me and told me, Jenny, we hear things going on, and we know that you're in trouble. If you ever need help, please talk to me and ask me. Her name was Yolanda. That's who it was. And I will help you to get into a safe house. And so I thought about what she said. And a couple of weeks later, sure enough, I had enough. I knew we were in trouble. The kids were in, big trouble. We all were in imminent danger. And I, I took the step, the courage to, to, to leave him. But it was really, really hard because I had no money. I had nowhere to go. And all I could do was believe the lady that she'll bring us to a safe house. And so she brought us to a restaurant where the safe house people helped us get to the safe house right away. And at the shelter, there were social workers who helped me get food stamps and financial aid and medical insurance. My children and I stayed at the shelter for almost a month. And one day the father found out where we were, the area that we were in. So he tried to get the kids from the elementary school, but the elementary school intervened and took the kids out and sent us to another shelter. But I, I wasn't well. I was anorexic. I, it was hard. It was hard to make that transition to go to another safe house. And when we got there, it was very dirty. It was unclean. Nobody was working there. It was just a lady with her kids there in the house. So I called my auntie. She lived in Monterey, and I told her, please, auntie, please help us get back, get out of here. It's not safe to be in this house. So she did. She sent us um, bus tickets to go to where she lived. So a social worker brought us to the bus terminal and left us stranded there. And we had a whole bunch of stuff to carry. Um, I had a very hard time. And we stayed at my aunt's house for a month until my ex-husband found us. He called and threatened me and saying, I will go there and kill you, the kids, your aunt and uncle. Not only was I scared, but my aunt and uncle were also frightened by the threats. As a result, my parents sent us 3 plane tickets to come back to Hawaii. So we came back home the day after Thanksgiving in 1987. I wanted so much to help my kids have a better life and to give them whatever they wanted, but especially I thought we'll live happily ever after. But I was wrong. My ex-husband and I, after a lot of fights and everything over the phone, we finally got a divorce in 1991. Soon afterwards, my daughter Christina was diagnosed with schizophrenia, and I was diagnosed with post-traumatic stress, dissociation features, conversion disorder features, psychoneuroses with anxiety, post-traumatic stress, borderline personality disorder, anorexia, and later in life, bipolar 1 depression. Christina's condition was so bad that she ended up in Liahi Hospital. It's a hospital where there was a psych ward for children there. And so she stayed there for about 4 months. And they try to help her, get better and everything. And, you know, I know that scientists and researchers say that there are people who have certain kind of mental illnesses due to genetic component. The mental illnesses include schizophrenia, bipolar, depression, and economic hardships or social struggles or low quality of life. If those people ha- have the mental illness become severe and they don't take medication or seek professional help, people with mental illness will get very sick or take their own lives or take other people's lives as well. When my children and I were receiving welfare benefits, there was a program called JOBS. It was Jobs, Opportunities, and Basic Skills Program. It was designed to help welfare recipients go to school, and they would help pay for childcare, so that we could have somebody take care of our children while we go to school and do our homework. So, and the staff of Jobs also kept track of all the clients. For me, I attended Leeward Community College, and I first started off with the PASS program, which was for students who didn't pass English or math exams. And the professors and staff helped us with English and math, but most of all, laid the foundation for all of us in order to take on college classes, and someday receive our bachelor's and master's degrees. In my third semester at LCC, I had a class that was political science class, and the instructors told us if we wanted to work for a representative called Mark Takai. He was a Hawaii state representative who worked in the Hawaii state capital for 20 years. And I said, yeah, because I was really interested in political science. And so I ended up working for him. And for many years, while working for him, Mark Takai helped me a great lot. I think because I was a single mom and I had two kids and we were living on our own. There was one time I ended up in a Queens Medical Center emergency room psych ward. Apparently I fell asleep and I woke up with Representative Takai sitting next to me. I wondered how he was able to get into the ER psych ward when no one was able to get in except the patients and the workers. But all he said was, I want to help you. And he was a huge mentor for me while I was at LCC and UH Manoa. In 1994, there were over 1,000 college students who were on welfare recipients in Hawaii. They were struggling to do, study and with the kids and everything. And then all of a sudden, President Bill Clinton signed a law saying that all welfare recipients going to school had to work 20 hours a week. And everybody was like, how are they going to do that? How are they going to take care of the kids, go to school, do their homework, help their kids do homework? I mean, they knew that they couldn't do it. So slowly and slowly, in 1999, there were less than 150 welfare recipients attending college in Hawaii. By July 1, 1999, 12,000 welfare recipients were dropped from the welfare rolls. I was amongst a group of students who managed to stay in school despite all the benefits that was taken away from me. Besides working 20 hours a week, I attended school full time, was a news reporter for the school newspaper, Kaleo, and living with my children near Paksali. I knew I wouldn't be able to succeed while doing multiple things. There are times my good parents have to make tough decisions, and my ex-husband was very active in a group called Basic Christian Community. So I thought he changed. So I agreed to have my son Charles live with his father and his family. It was a hard decision, but I thought it was a really good decision at that time, especially because I wanted to succeed and make a home for my two children and me. While I was in school, I somehow was able to work as a news reporter for Film Courier. And that's where I met my future husband, Pancho, who I'm married to today. I received my Bachelor's of Journalism from UH Manoa in 2000. My intention was to work in the media, and I tried to apply to Army Star Bulletin, but there weren't hiring at the time, so I ended up working for the accounting firm. I felt like I failed because I didn't get a job in the media. I kept telling myself, I failed, I failed. I remember being so depressed that I took about 40 to 50 ibuprofen and drank a whole bottle of wine. I ended up picking up in the Queen's emergency room, and there was a doctor on one side of me and my sister on the other side of me. They said, we didn't think you were going to make it. They both said. While in Killer, they found out that I was an alcoholic. So I sat to attend AA classes and meetings. By after a year and a half, I stopped drinking, and I haven't drank for 20 years. In May of 2002, an old friend of mine from the HMNO saw me in the Queen's Medical Center, and she said there was an opening in a newspaper. So I tried to apply. Eventually, I was hired and was there for nearly 17 years. Pancha eventually got married, and Pancha and I eventually got married in 2007. He was a great supporter to me, especially in the past 2 years. In 2016, I was diagnosed with breast cancer. As a result, I had surgery and radiation. In addition to all that, I also received electroconvulsive therapy, ECT, for many years. The people who took, I knew people look down on others who have mental illness, especially patients receiving shock treatments. Before, I didn't want to talk about it, but now I realize it was an answer to all my suicide attempts. ECT kept me alive. One thing that was overlooked and who suffered the most was my son Charles. He lived with his father and his family, who never took the initiative to help him in life, school, or his health. And we didn't know because Charles didn't talk to me or his sister about it. In October 2018, my son was admitted to Waiwa General Hospital for chronic diabetes. I found out that the father didn't get him medical insurance, so he didn't see a doctor for 20 years. So no one knew he was really, really sick. And so during during the 2019, my son disappeared. He got into a fight with his father and he disappeared, and we couldn't find him for 4 months. We didn't know where he was or anything. We were devastated. And when we finally found him on the bus, he had acute kidney disease, sepsis. His feet was all raw underneath his foot, and his liver wasn't working. By Thanksgiving 2019, the doctors from Queens said he had only 3 weeks to live. As a result, I went on TDI and FMLA immediately, and I took care of Charles 24/7. We did find out though that he had schizophrenia too around that time, but we didn't know because his father never brought him to a social worker or a psychiatrist or nothing, so we didn't know he was also sick. During Christmas week 2019, My daughter Christina was missing. I looked and searched all over for her and even waited for her outside the apartment building where she lived for 5 hours on Christmas Day. I sat on the bench at the entrance and never moved an inch, hoping my daughter would show up. The day after Christmas, Pancho and I was on our way to my daughter's apartment complex. Halfway there, the security guard at my daughter's apartment complex called me and they said, "We found her. She Maki in the bathroom tub." She said, "Maki means that she died in the bathroom tub." 4 months later, the medical examiner said Christina died of a heart attack, which I was surprised because I thought she died of suicide, but it was because of a heart attack. My whole world stopped, and I cried for hours and hours. The devastation I felt was so huge. To top it off, I knew my son Charles had was gonna get sick, and and it was around that time I didn't write it in here, but that time I ended up in the hospital because I taken 20 pills of Xanax, and they I ended up waking up in the hospital, and the hospital said, "Jenny, people usually die when taking that much Xanax at the same time, but you survived." And it really made me think for a long time what she said. So 14 days later, Charles did pass away. To top it off, he died of a heart attack and died of complications from diabetes 42 days after the death of my daughter Christina. I never ever felt so much despair and total depression before then. A month after the funeral, which was held together, I received a letter from Human Resources for the paper I worked for. A place where I put 120% of my time into my job, but they let me go. I was so depressed, so I was really not all there already. To top it off, that very same day, while I was at the hospital due to the severity of my mental illness, I was told I had COVID-19. Imagine, what next? Luckily, my psychiatrist back then at Kaiser told me that to attend the Queen's Day treatment services. For a year and a half, 5 days a week, at 5 hours a day, I joined 15 other participants to take classes that would help me understand my illnesses, how to cope with it, and having a support group that I so desperately needed. A couple months before I graduated from the program, the suicide attempts finally ceased, and I didn't feel like as if the tragedies of 2 years ago just happened yesterday. Ever since I was a teenager, I loved to read, and I continued to read even till today and as I became an adult. My favorite authors today are James Patterson and Danelle Steele. All my life, I was excellent in writing, and even in the days when I was going to school, the English professors would tell me, I can't correct your essays because nothing's wrong with it." I would laugh when they say that. In a 15 years later, after getting no, I'm sorry. Oh, I know what. 15 years later, after getting turned down for the reporter position at Hungry Star Advertiser, I wrote my first book, Falling Perfectly Without Trying. It was a book of my domestic violence um, situation, the things I went through step to step, and the journey we took for a better life. Today, the publisher is trying to change the book so that it'll include having my two children pass away as well, because it was printed before in 2018. By having the love to read and being able to write well, I wanted to write books. My goal is to write stories about inspirational people who have succeeded, so others will know about those inspirational stories and they can have hope in their own lives. Hope is what people keeps people moving toward in life. I know I have said a great lot about my journey. Even though I experienced a great deal of trauma, I came out of it on the other side. But it doesn't mean everything is perfect. I don't think anyone lives in a perfect world. You just learn to cope with all the trauma and tragedies with professional people's help. If a person like me who lost everything but still managed to put one foot in front of the other, I believe anyone else can if they have hope. Thank you for listening.
Hi, Jenny. Thank you so much for being so vulnerable and sharing your story. I'm gonna open up the chat, or just even if you want to unmute, if anyone has any questions specific for to Jenny or your story. We're getting a lot of mahalos for sharing. And then Dr. Ali Kata, if you have any like insight also. I guess one of the questions I have, I know you mentioned early on that you initially received a lot of support from social workers. Can you share, since we have so many social workers joining us, can you share details in particular about what was most helpful for that, the most helpful thing that they did, or even like a moment of extreme kindness that you felt because they were able to connect you with a specific resource?
Well, we got to know the social workers really good in the jobs program. There were a lot of social workers, and each social worker was assigned to certain people, and they knew us really well because we had to talk to them every week, and they were able to encourage us to keep on going. They were very kind, very understanding, especially when they told us we had to go to work. They couldn't believe that the president did that. And also, what that also helped was they gave us money to pay for our babysitting, um, for our babysitter to take care of our kids, because it's hard, especially in Hawaii. It's hard to find somebody to look for a babysitter, and you have to pay them so much money, but the state gave us money to pay for that. Yeah.
Wow, thank you. Any questions from our attendees? We're getting a lot of mahalos for you being so open.
Thank you, Jenny, for sharing that. Could you share with our group how you've changed that energy and focus into helping others? I know when Caroline Kunitake reached out to us from Department of Health, she said that you're focusing a lot of your time in helping other women. And can you share a little bit about that with the group?
Yes, I recently joined a group. Even before that, like 2 years ago, I was saying speeches for people with mental illness and domestic violence because I thought perhaps in fact I knew that it related to each other, and because of the trauma and everything. So I was speaking. I was doing a lot of speeches and ended up speaking at a shelter that my good friend was in charge of, and I told them my story. And then I wanted to give them more, but I was that kind of person that never have money. I couldn't help. And that's all those. After 2 years, a couple of months ago, I met up with a group called the Aloha Pono Lions Club, and I asked them, "Can you help me to bring Halloween candies for the kids for Halloween?" And they said, "Yes, yes, we'll help." They all wanted to help, so we formed like we got all kinds of candy, put it together, and gave it to a safe house. But we had to give it to somebody, and we never saw the kids. We just gave it to somebody, and they would give it to the kids. But after that, they found out that the mothers needed food because they always run out of money for food, and so they gave a lot of food at one time. The same Aloha Puna Club and me gave food. And then we spent a lot of our money trying to buy Christmas presents for the kids. Um, and the parents. The kids were like 29, I think it was at 49 kids and 25 mothers. And 25 mothers had $25 each gift cards for Walmart. And the kids had a lot of toys. We bought them toys, but it was to a lot of help. Not only me and the Aloha Pono Club, but also other people, because other people saw an article I wrote. No, yeah, I wrote in the newspaper at the Honolulu Star Advertiser. They saw that article, and they immediately contacted me to various people, and they gave some toys and the gift cards and everything. But at least 2 years ago I was stranded. They couldn't help them. I wish I could help them, but at least now I can. And I did. And yes, Gerald Coffey said many clients I refer to the Queen's Day treatment services. Yes, there's a lot of clients there that need help. I mean, and they help them a lot. They help them a great lot. Yeah.
Let's
But
see. Lots of people saying they admire your strength and your courage. We had one person ask, so Taryn shares, I don't know if I'd be as strong as you. Was there something you would tell yourself that kept you going? What kept you motivated?
you know, at the beginning, I don't know. I don't know how it. I don't know how I had it. I knew some. It was between when I was at Leeway Community College. I somehow had the courage and a challenge, and was able to overcome all the challenges and the obstacles to go to finish school and everything. But I don't know how I kept it after all those years. I think what I think is that God didn't want me to die, because I'm sure enough would be dead today if God didn't intervene. I think that there's a reason why I'm alive, because and how I kept that hope and dream inside of me, I have no idea. Yeah.
Thank you. Gerald Coffey asks, many clients I have referred to the Queen's Day Treatment Program. They often hesitate to go. Can you share one of the most important things that the program helped you with? I want to share what is most impacting with my clients.
Um, I think the support you get out of it, especially if you have to go 5 days a week and 5 hours a day. You know, it's the support is so great. And when you don't, and if there's a holiday, you don't have a class, you kind of miss it. And the workers are very understanding. They're really really caring. Um, there's many times I had a therapist and there, a counselor, because every counselor is appointed to one person, right? For 1 hour of therapy. So she knew I was still suicidal, and she would help me through it all. The first time I was there, 2 years ago, 4 years ago. So they're very caring. They what helped me the most was all I can say that they're very caring. They understand. They they tell you what's happening, and they tell you why you feel the way you feel, and I don't know how to say much, but they really care. Yeah. I hope
Mm.
that answers your question.
Oh, I think that definitely um answered Dr. Coffin's question. Dan, did you have any other commentary? I know that you also work at Queens and are familiar with the day treatment program.
Yeah, sure. Thank you. And Jenny, thank you so much for sharing with us your journey, your life, and also for sharing with us the hope that you have. Um, my concern, we have a lot of children in a day program at Queens too, and I think one of the greatest needs we have as a state is to increase the access for all people of Hawaii to the levels of care like you experience, the day treatment programs and intensive outpatient programs for adults and children across the state. We're in desperate need. These are the efforts that I believe Queens is working on, and the rest of the communities too. But I think your life has provided inspiration for the rest of us to be able to be there for our families and be there for our patients. So thank you.
You're welcome. Do you want me to do anything for you to help increase the um how maybe talk to them or something, or is
If,
it a
do you meet with Queens
huh?
regularly? I know Queens is very um, focused on trying to expand resources for all very rural communities across the state. And I know that they're collaborating with lots of state agencies, the Department of Health for both adults and children, in trying to develop these resources, whether they're in hospitals or within maybe residential programs within the communities. But we are in desperate need for those resources.
I can I say something?
Sure, of course.
I didn't know. I didn't tell my speech because this just happened. In December, I took a 2 week course, accelerated course, and to become a peer specialist. And I went through it. I took the exam, 19-hour exam, and I passed. So now they're trying to put me somewhere where they think they need me, somewhere in the state that needs me. Just to let you know.
That's awesome.
Yeah, that is awesome. Very encouraging. Thank you for sharing that.
Yes. Hi. May I say something? And Jenny, this is Madeline Hiraganuccio. I'm with the Child and Adolescent Mental Health Division, part of the Department of Health. And what I was thinking when you and Dan were talking, especially given your ability to speak publicly, to write so well, and all of your experiences, including the training as a peer specialist. I'm just wondering if you might be willing, if some of our colleagues are interested as they present legislation and try and develop bills to pass through the local legislature, if you might be willing to be a spokesperson or at least to talk about your experiences with the system, because I think that might move some of our legislators to understand better and look favorably about around some of the kinds of bills that we're trying to move through to get more funding, more appropriate treatment options to make our state more wellness focused and resilient.
Yeah, I would love to help in any way I can. So
I'll send a email to connect both Madeline and yourself, Jenny, so that you have each other's contact information and you folks can work together. Because delivering testimony, I think, is very powerful. And I know Dr. Withy would definitely advocate for that, as well as Dan. So I'd be happy to at least get you connected, because I second what Madeline said, being able to not only go through that, but able to express it and share it effectively is what I think will move our legislators, because they'll see what they're advocating for come to life, because you've been able to uh, benefit greatly from a lot of resources. So I already have it drafted. I'll send it once our session is done, just connecting the two of you. Dan, I'll put you on that email as well so that you have Jenny's contact information if there's ever an appropriate time for Jenny to share about being a success story, essentially, for the day program at Queens that I didn't even know existed. And so I'm glad that, Jenny, you're a walking testimony to that. Any other questions or just commentary for Jenny? Jenny, do you have anything else you would like to share? I think, yeah, even getting that peer certification is awesome, and I think is again another testament to what your purpose is being here.
Thank you. I want to say something. An article was written about me in midweek, in on Christmas Day. You want me to send it to you? Sure.
Yes, please do. I'm gonna put it on the website. I saw that you also had another article that I was looking for your midweek article, but I think you wrote one too called "We Need to Encourage More People to Pursue Higher Education." I think Civil Beat they included you in that article, or you wrote that article along Caroline, who introduced you to Summer. So is it okay if I include that link too?
Okay. Okay.
Yeah, and then I have the link to your book also that I'll put on our iEcho website. But yes, please send me the PDF or the midweek article, because I couldn't find that one. So I'd love to post it and share. We have Renata here. She says grief is one of the most challenging emotions to navigate on any level experience. When you recognize it being experienced by someone, how do you help those in the most challenging times of grief begin to notice their own acceptance of their own humanity again? So would you be able to share about how you were able to just navigate your grief, losing both of your children, essentially a day after each other, basically, how you were able to get through that experience?
I I think it was the Queen's Day Treatment Services that helped me a great lot to overcome that, because it took me a lot of time. I was able to go. I was in it for about almost 2 years, and it helped a lot. I also while I was in a hospital when I had overdosed on Xanax, I had some people from the HMO had came up to me and told me to write a book. And I think because they wanted me to have a reason to live, because they knew I tried to take my own life. And so I wrote the book, Mark Takai's Legacy. So after I wrote that, I mean, it took 4 years to finish it, but I was able to do both, go to treatment, and then finish the book at the same time. And I also was in this group called NAMI, National Alliance of Mental Illness. I'm a spokesperson for them. Yeah, I speak for the police academy and stuff like that. Yeah,
Yeah, we actually have
but
NAMI come on regularly. So it's good. We've had several of the folks at NAMI share. So it's so nice to see you all interconnected. In relation to domestic violence, are there any resources that stand out to you in Hawaii? Or what was your experience? I know a lot of your DV experience was in the mainland. And then what would you recommend here in Hawaii for those as far as like a safe house or where social workers can begin to refer or not even just social workers, anyone on this talk can start to connect their clients with resources?
I would go to DVAC, Domestic Violence Action Center, because they help a lot. You know, they send the girls to um, isolated places where they can be safe. You know, like the one we were trying to help. Nobody knew where it was except me. You know, so and the person that drove me, but basically nobody knows where it is. Yeah, so um, yeah, DVAC is pretty good. Yeah. I mean, whenever you're in trouble and the cops come, they come too if it's a domestic violence situation. Yeah.
Mhm.